Morphine, commonly known as MS-Contin, or Roxanol, but it's widely available as just a generic morphine. It is an opioid analgesic. It is a Schedule II drug according to the FDA. Mechanism of action, opioid receptor agonist, which will then block pain stimulations. It can also, or it does also, suppress fear, anxiety, and the respiratory centers in the brain. So it is a very good anxiolytic and then a respiratory depressant. It can also cause some slight vasodilation and hypotension possibly. Pregnancy class is C, and it will cross the blood placental barrier, although they're not really sure if it causes any harm to the fetus. So, what we use it for pain, moderate to severe pain of any source really, and then it's also pretty common to use it for chest pain as well, because it does decrease the workload on the heart. Contraindications, hypotension, head injuries, hypovolemia, decreased level of consciousness, any of those, undiagnosed abdominal pain, COPD exacerbation, and then MAOI use in the past 14 days. And the main thing on that undiagnosed abdominal pain is because morphine is a good drug and it lasts in the body for a long time, so it can affect the doctor's ability to do a good abdominal assessment if you've already gotten rid of the pain. Fentanyl would be a better drug for abdominal pain that's undiagnosed. Adverse reactions, CNS depression is the biggest one. You name it, respiratory depression you get with that, bradycardia, some hypotension possibly. Any of those can be caused all due to the CNS depression, some sedation even. It can also cause some shortness of breath, syncope, nausea, vomiting, and dry mouth. Drug interactions, it will potentiate sedative effects of phenothiazines. Like we mentioned before, MAOIs, they may cause some central nervous system excitation. That's why we avoid that. And then if someone is taking other CNS depressants, it can be potentiated by morphine. Typical adult dosing, 2 to 8 milligrams IV, IO, IM, sub-Q if you want to do it that way. Pediatrics, 0.1 to 0.2 milligrams per kilogram, up to usually a maximum of 5 milligrams at a time. Onsets can be about 1 to 2 minutes, peak effects within 20 minutes, and it's going to stay working in the body for 2 to 7 hours. So it does last quite a while. Some special considerations to think about. It may have a vagotonic effect on the inferior MI patients, so that can cause some syncope and increasing that vagus nerve with those patients, so something to watch for. And then always keep in mind that naloxone or Narcan is the antidote for it, since it is an opioid.